Welcome to Grad-post. I'm your host, Brian S. Mitchell, and we're here to talk about life before, during, and after graduate school, and whether an advanced degree is right for you. I'll draw upon my experiences as a graduate dean and research mentor, as well as my network of students, colleagues, and experts to bring you the most complete information on graduate education that I can. Seeing as how May is Mental Health Awareness Month, I thought I'd highlight mental well-being in our graduate student populations. I'd like to do this in three parts. First, outlining what we know about the state of graduate student mental health on our campuses. Second, what program and graduate school faculty, staff, and administrators can do to promote mental wellness. And third, what you as a graduate student can do to maintain your own mental health and those closest to you. So, what do we know about mental well-being in graduate students? Well, there are some unique challenges. In general, some psychiatric disorders can manifest themselves as the human brain begins to reach full maturity in the mid to late 20s. According to the Centers for Disease Control, the percentage of adults experiencing depressive symptoms is highest in the 18 to 29-year-old group at about 20%. Though there is no typical graduate student age, roughly half of doctorate recipients in 2021 fell within the 26 to 30-year age bracket, according to Statista. So it follows that the prevalence of mental health disorders would track the demographics to some extent. But it could also be worse in the high-stress environment of graduate school than in the general population. A 2018 survey by Evans and colleagues of over 2,200 graduate students from 234 institutions found that graduate students are 6 times as likely as the general population to experience depression and anxiety. COVID-19 was particularly hard on graduate students, with a 2021 survey of 3,500 graduate students at 12 public institutions reporting that 2/3 of respondents scored low on well-being factors. There's much more research needed on all the stress factors that can lead to these statistics, but if you are or were recently pursuing an advanced degree, you certainly know what some of them are. And if you belong to an underrepresented or minoritized group, or are an international student, you know that there are stress factors specific to you. According to Dr. Jenny Lee at the University of Arizona, international students on U.S. campuses face social isolation, language barriers, cultural adjustment, and can be subject to neo-racism and related safety concerns. These factors can lead to an underutilization of university mental health services. What you may not know is that there are disciplinary differences too. One of the more important reports in this regard came from the University of California, Berkeley in 2014. In their graduate student population, they found that arts and humanities students reached the threshold for depression at nearly twice the rate of those in the social sciences. It's not just U.S. institutions either. A recent study from Canada had similar findings about increased rates of burnout, stress, and anxiety in psychology graduate students. So there are definitely mental health issues when it comes to graduate students for a variety of reasons. What can we do about it? For those of you who are in positions of responsibility, whether you are a faculty mentor, program administrator, or even a provost, we can cover a lot of this ground by simply looking at the recommendations from a recent report. The JED Foundation, the Alfred P. Sloan Foundation, the Andrew W. Mellon Foundation, and the Council of Graduate Schools, CGS, recently published a report entitled Supporting Graduate Student Mental Health and Wellbeing. JED is a nonprofit that protects emotional health and prevents suicide for young adults. They partner with colleges to strengthen their mental health, substance misuse, and suicide prevention programs and systems. Their collaborative report contains sets of recommendations for university senior leaders, graduate deans, program staff, faculty members, funding agencies, and graduate students. We won't go through all of these recommendations today, but I invite you to read the executive summary at a minimum to improve mental health awareness on your campuses. Here are a few key ways that administrators, faculty, and staff can do this. Include training on graduate student mental well-being for new faculty and program staff. Periodically review graduate student leave policies so that they have the flexibility to allow students to remain partially engaged with their programs during approved leave. More on this in a moment. Investigate how time to degree or funding limits might be changed to promote work-life balance and the highest levels of academic performance. Create a source of funding to support wellness days, mental health campaigns, or events. I know from my time as a graduate dean that some of the most difficult and heartbreaking situations involved a combination of unresolved mental health issues and academic difficulties. Of course, not all students with academic difficulties have mental health challenges, and not all students with a mental health issue have academic challenges. I'm not equating the two by any means. I'm saying that in those instances where an unresolved mental health issue impacted a student's ability to perform academically, the two became intertwined and related. And if there were student conduct issues on top of that, the situation could become grave. I could help with some of the academic challenges, whether it was talking with program administrators and faculty to give students additional time or considerations, but there was little I could do to help these students with the mental health component except refer them to the trained healthcare professionals. There are administrative policies to help with that aspect too, which I'll get to in a moment. But there's little I can say in a podcast to help you if you are in need of mental health counseling, which is where we come to you, the graduate student. Please seek help if you or someone you know needs it. As recommended by the JED CGS report, here are some actions at your disposal. Reach out to student affairs professionals, faculty, and counseling services when you observe students in distress. Play a role in peer mentoring and other initiatives designed to support student well-being on campus. And finally, embody principles of self-care and compassionate mentoring as teaching assistants of undergraduates. Finally, if you or someone you know is in immediate crisis, please contact the Suicide and Crisis Lifeline by simply dialing 988 on your phone. Help is available 24 hours a day in both English and Spanish. There are more resources in the links section of the transcript available on my website. I also want to make you aware of one option that is at your disposal that you may not have considered, a leave of absence. This is one of those tools that I could deploy to assist graduate students that faculty and administrators were often not aware of. At most institutions, medical leave policies are applicable in instances of either physical or mental illness. As an example, check out the leave of absence policy at the University of Michigan Rackham Graduate School. It clearly spells out when and how you can apply for a medical leave and the documentation required to request it. Their policy is generous, up to 2 years on leave of absence for medical reasons. If your university or college does not have a well-documented process for requesting a medical leave of absence for mental health reasons, the best thing you could do to support mental wellness on your campus is to make sure they get one. And if you think you need a leave of absence to address your mental wellness, then take advantage of what is available. It's there for you. We all know someone with mental health challenges. While we may not be able to help them directly, we can always point them to someone who is trained to help. Many thanks to all of you in the medical community who provide that assistance. Your degrees certainly count. All of the links provided in this podcast are available on my website at gradpost.com. That's grad-post. There you'll find additional resources to help you on your journey to an advanced degree.